The female's suffering is from the household activities. It's not from outside.
I've always heard sir telling if you want to reduce weight, whatever you're eating, eat, just eat half.
Diet and the way the diet is being marketed in the society all over the world is absolutely nonsense. Green tea is completely a nonsense thing. It doesn't have anything which can improve your health.
I believe if Indian females are healthy, they are ready to take care of the family. The family is healthy.
There is a treatment which is known as regenerative therapy where in a knee, for example, if you see a problem in the knee, there are a few structures in the knee. Those structures, if we can regenerate with the patient's own blood, it will completely regenerate.
Yes.
Completely patient will become pain-free. This was there since almost 30 years.
What are the ways that females should know that after 30 my joint is also going to degenerate? What are the things that they should be careful about so that they don't land up to a stage where they have to go for such kind of invasive things? Hello everyone, warm welcome to my podcast Rise and Shine with Dr. Minal. Here is my first podcast, shooting with my mentor Dr. Sudheer Dara. So Dr. Sudheer Dara is the man behind introducing regenerative medicine to the world. Regenerative medicine is basically a branch of medicine where we treat patients using their own natural growth factors from their blood cells. And this branch came into picture in India only after efforts of Dr. Sudheer Dara, after his 15 to 20 years of research, and after introducing this concept and preserving more than 50,000 patients with this modality of treatment. And not only this, he groomed a lot of budding physicians who actually wanted to come into pain medicine and regenerative medicine and helped us all establish their own pain clinics. So, here we have the man behind this modality, the man who introduced this modality to the world, Dr. Sudheer Dara. So, we have Dr. Sudheer, like I was introducing him. I have been working with him since last 8 to 9 years. And the most fascinating thing that I have come to know is the way he deals with female patients. A lot of we deal with lot of geriatric patients, old patients जो दर्द से हमारे पास आते हैं. जब भी वो सुधीर सर के पास जाते हैं, there is a different kind of connection because he catches every female का एक particular point, and the way they connect to the patient, the way they connect to sir is really different. So sir, how do you whenever we see you seeing OPD and female patients आते हैं, you don't let the male partners और उनके बच्चे और spouse जो भी आते हैं, and you always give them a chance to talk, which is what I have seen that female connect to you directly because someone is asking them to talk and someone is ready to listen. So how do you get that connect? How do you find what I need to talk to this patient?
Yeah, whenever you see in chronic pain management, particularly in pain clinics where we work, most of them are females only. You know all the reasons why females they get pains early. They keep on working in the household or in the outside also, in spite of having pain. So what as a doctor we should be doing is first listen to the female patient. So whenever a female patient comes with the family, so the patient will be sitting here. In front of me, the husband will be sitting, and his son, and the daughter-in-law. So whenever I ask, I wish the patient, and then I ask, what made you to come to me? Then, without answering, she turns her head towards the husband. So she doesn't want to answer. Maybe she's not allowed to answer, and the husband starts answering. So this is where I thought in Indian females, they are not ready to express their pains even at home also. So this is where the women are not properly treated. Because at home also, suppose for example a 35 years female gets pain, maybe it's knee joint pain or back pain. Basically they are very afraid of telling this to the family members because they might strike back saying that no, you don't want to work, that's why you're doing this. And the female also feels that no, at 35 years if I complain of pain, what the society will think, what the family will think. So that's the reason why whenever a patient comes to me, whenever a patient sits before me, I keep all the others, all the attendants completely calm and don't talk to them. and I talk to the patient herself. So I make it a point. No, some females are very furious also in this aspect. They'll always look at the family. They want those family members to answer. This is always wrong. So I always want to get the correct information from the patient, who is particularly a female, because if they don't talk, the whole of the treatment, the whole of the understanding of the problem will go in a wrong way. That's why I always talk to the females. And as a doctor, so you all know, no, you need to get the information from the patient, not from the surrounding people. If the patient gives the answer, each question I ask and the answer what we get from the patient, no, is very very important. If someone else is answering it, it goes into completely wrong. And these the husbands basically, no, they want to overcome. No, she's having pain since 5 years, and they will take over everything, and all the diagnostic criteria, all the way we manage the patient will go in a wrong way. That's why I always want the female to talk if they come with a problem.
I have always seen, when you ask what you do, so immediately the answer will come, I'm a housewife. Or the male partner will say, nothing sir, घर का ही काम करते. And the way you tell them कि घर का काम ही ज़्यादा होता है, बाहर काम करने वाले लोग, they are okay, but this is what you do. So how did you realize this, that this is impacting the chronic pain that we deal with?
Sorry to say, no, for all the female patients who come to me, no, and also the family, I tell only one thing. The worst thing a female gets as the female's suffering is from the household activities. It's not from outside. Because females think that household activities are very normal. Household activities, they don't harm the patient, harm them. And the whole of the family also thinks that no, household activities, they're not dangerous. But the science says, the medical science says that if you work for almost 6 to 7 or 8 hours at home from morning to evening, that's the most dangerous aspect of female chronic degeneration. If you get a knee joint pain, you get a back pain or a shoulder pain, the most commonest cause is the household activities. So whenever I ask a patient husband or the son or son-in-law or the patient herself, I ask them, no, you are having so much of pain in the knee, you are having so much pain in the back, I think you must be doing a lot of work. Then immediately the attendants, they will tell, no sir, she doesn't work, she works at home only. That's only the dangerous thing. That is the most, the worst thing that can happen to any female. Because, a female who is working outside from 9 o'clock to evening 6, most of the females, if they are not a teacher, if they are not a constables, where the standing is much, if they are having a sitting job, at that point of time, 7 to 8 hours, their body is at rest. But the same female, if she's not working and she's a homemaker, then the amount of the damage that happens in those 8 hours when she's at home is very, very high. Why? Because they don't sit. They keep on working. Even if there is no work, they'll be working only. See, in a small household, no, where the house area is around 2,000 to 2,500 SFT. If you do everything like, no, from 6 o'clock onwards, whatever the work like, no, the cleaning, the clothes washing and all, and the cooking and taking care of the kids and all, if you do perfectly, it will take 2 to 2.5 hours. But our females, our Indian females, so they stand for like 11 to 12 hours. From morning 6 to evening 11, they'll keep on moving and all. And this is the major reason why so many females are having lots of chronic pains, whether it's a back pain, knee pain, ankle pain, or shoulder. So the most dangerous thing that can happen to women in terms of chronic pain is household work.
So in such cases, we know that we also need support from the family members, be it the husband or the son or any other. So how do you get that support for your patient? Like, it's very difficult to counsel the husband also. If you tell the husband, no, she should not be standing for cooking for an hour, it is difficult for the husband to accept this. So how do you create that comfortable space for your patients?
No, what we tell, no, we tell the facts. See, the whole of the family comes to the clinic in search of good relief to the patient, to their mother or wife or anyone else. What, as a doctor, no, we have to be very strict. We have to be very clear to the patient and also the family members that if you continue the same thing, any treatment in this world will not save you. If it's a case of degenerative condition like knee joint pain, spine pain, or shoulder pain, and you need to find out, no, first what is the reason. If the reason is household works, all the family members must support her, or otherwise, if you are okay, you get some servant maid.
Help.
So that's the point where, no, you see, whenever I get a patient, I don't no, get them into wrong way. Like, no, I will treat you so that you can go and do your household works back. No, no, not like that. In our clinic, in my treatment, with my patients, I'll be very, very honest saying that to the family members also. If your wife, if your mother wants to get back to normal, normalcy means get back to normal her own activities. It is not the household activities. We get patients, no, with in the age of 60 to 70, 75 also, 80 also. Still they want to work. Still the family members wants them to work, make them work. And they are coming for the treatment to make them work again. So that's, we are dead against that. So what is the reason for the pain and why it is coming so? And particularly for that patient, what are all the things which are leading to this type of pain? We need to first of all take care of those things and ask the family to involve in this. Ask every family member to work on this. If they are adamant, we don't treat the patients. We tell them, if you are okay with my conditions, I'll treat. You need to support her. You need to support in all aspects and make her, take proper rest, proper exercises, and take this treatment. And we are treating the chronic pain patients not to work, to have a healthy, happy
quality of
life
life.
in the future.
So while we are talking about chronic pain, especially in females, we see a lot of things. It has to be in a disciplinary way. Multidisciplinary context has to be there. So sometimes we need to ask the patients to reduce weight, and we give them good diet changes, some exercises, and all those things. But patients come up with their own ideas because we see that social media is flooded with so many ideas of things, and the very next question that patient would ask is, can I go for things like, for example, green tea, where I have seen a lot of time you have your own opinion on things like green tea or things like fancy things, apple cider vinegar and all those things coming into market. People are taking it. How do you see this helping patients? What is your opinion? How much this should be a part of a diet protocol, because we deal with a lot of patients having such kind of conditions.
See, what I have observed, no, all through my medical, experience. So diet and the way the diet is being, marketed in the society all over the world is absolutely nonsense. Because diet is something, for example, you have a bike, petrol bike. If you put diesel into that, what will happen? Immediately the
break.
engine will go into
Break.
completely, So the diet means a healthy diet is the diet which you start taking from your birth. The diet till you die, what you have to take is the diet which has been given to you by your mother and father. So if you're a South Indian, you're taking idli, upma, puri, dosa in the morning, take that. If you want to reduce the amount of the food, that's okay. In the lunch, if you're taking rice, dal, curry, non-veg if you want, take that at the same time. And in the night, the same food which you have been taking since your childbirth. Apart from this, anything, any information, saying that no, this protein, that protein, whey protein, and magnesium, all these things is a complete bullshit. There is no evidence anywhere in the world saying that change your diet to the commercial diets. What are the preparations they sell for thousands of rupees is going to better your health is not there. So the diet is just like your body has grown up by
Eating
taking the food which you
since
have been
child-
taking since childhood. No, that is the diet.
Yeah.
There is no any rocket science in that.
Yeah.
If you're taking the regular food, if you're North Indian, no, you take certain diet, no,
Yeah.
since your childhood, take that. Don't fall prey for all these
Yes.
nonsense commercial things, where the film stars and all come and you take this and all. There's a muscle protein. Muscle protein has to increase. You take a whey protein, and a lot of other things are there, which are basically they're not there in the medical literature.
Yeah.
So diet is always the diet which I have been taking since childhood.
Yeah.
Nothing else.
I've always heard sir telling, if you want to reduce weight, whatever you're eating, just eat half. This is what we have been practicing in our.
And about green tea also.
Yeah.
No, when I entered in the studio, no, the studio staff were asking, so you want to have a green
Green
tea? Anywhere I go in Hyderabad, no, wherever some corporate hospitals or nowadays I'm seeing at my friend's place also, you want a green tea. I'll tell you something about green tea. Green tea is completely a nonsense thing. It doesn't have anything which can improve your health. Green tea, one statement if you want to say, green tea gives you only 5 minutes of torture of that bitter taste. Nothing else is going to get from green tea. Don't ever think that no green tea is going to protect your health
Health
or
from-
correct your
yeah.
health or make you more healthier.
Yeah.
That's nonsense. Don't believe in green
Yeah,
tea.
because we see a lot of patients, no, sir, who have been coming with such kind of diets and so long. But why are they coming to us with pain again? If green tea was the solution to everything. So again, coming to what you have revolutionized in India is patients of chronic pain, where you have preserved more than 50,000 joints, and that is by the concept of regenerative medicine, a modality of medicine which was there in the West since long, but in India people didn't come forward to to open up and give this option to the patient. How did you come across this, and how did you realize now this is the solution that India needs? This is the solution that Indian females need, because my podcast is basically a female oriented podcast, and I would want that how you think that this thing will is going to improve the quality of life of Indian females, because I believe if Indian females are healthy, they are ready to take care of the family is healthy. So when you revolutionized with regenerative, what was the entire thing behind it? What was your struggle? What is the output? What is regenerative medicine?
So
like?
basically, what happens is the meaning of the definition of advancement in healthcare is creating comfort, creating a less invasive kinds of treatments for the humankind. So now, advancement of healthcare should be, for example, if you are cutting open the body and removing something and suturing it again, the advancement means in future the cutting should not be there.
Yeah.
Do something where you need not open the body, you need not put a knife on the human body. But what's happening is, because of lots of other reasons, every medical problem has been a kind of putting the human's body into more and more destructive kind of treatments. Now we see, for example, we take knee replacement surgery. Now knee replacement surgery advancement should be there should be something else apart from cutting your knee open with a small injection. Can you treat the pathology or the problem inside the knee joint? That is advancement. Now that's not happening. You cut with the knife, then afterwards you cut with a robo, then afterwards you cut with an artificial intelligence. This is not the advancement. Advancement means the knee joint, which has been opening, no, since almost like 50 years. There should be an alternative,
Yes.
so that an injection or an ointment or an oil should be treating that.
Yes.
So that is the new advancement, or the future. So in the same way, knee replacement surgery or any surgery, there are lots of natural things which have been there since long. When we are doing anesthesia, I'm an anesthesiologist. When we were doing anesthesia, we used to see lots of joints being open, lots of spine being operated. And then I used to think that, now, can we do something else for this? Because these are all not diseases. Knee joint arthritis is not a disease. Spine disc prolapse is not a disease. It's a condition. I used to always think about, no, can we do something else for this? Because as an anesthesiologist, we are experts in the injections. So I searched a lot, and I found out that, no, there were lots of injections. There were lots of minimally invasive procedures where all these conditions can be treated. So one of the treatments is, particularly for the joints, particularly for the female joints. So 60 to 70% of the joint pains are suffered by females only. So there is a treatment which is known as regenerative therapy, where in a knee, for example, if you see a problem in the knee, there are a few structures in the knee. Those structures, if we can, regenerate with the patient's own blood,
Yeah.
it will completely regenerate.
Yes.
Completely, patient will become pain free.
Yeah.
This was there since almost 30 years. No one tried it because of a lot of other reasons. Because of the fancy, nature of cutting open, putting an implant inside, fixing it with cement and all. So that has become a famous thing, and that's been thrown onto the people since almost like 40 years. And people thought that, yeah, this is the only way we have to get rid of this knee pains. First, initially you get a knee pain, you take tablets, you do some physiotherapy. If it's not happening, then finally I have to go to
Knee
knee replacement surgery. So what I thought is, why can't we, popularize this?
Yes.
Why can't we get this back to the public?
Yeah.
So 8 years back, what was the regenerative therapy? Different modules of regenerative therapy, particularly for knee joints and shoulder joints, spine, and other small joints. So I thought that this would be a very good change for the humankind, and I started doing it. So when I started it, there were lots of hurdles. First of all, my mind did not accept that I am telling the patient that, no, I do this treatment with a small injection with your own blood. This is going to completely make you pain free,
Sure, yeah.
which I didn't believe initially, because I was an anesthesiologist. I given anesthesia to thousands of these joint pains. So I also was a bit biased that finally surgery is the main thing. But once I started this, 2 months after, 2 to 3 months after, the results what I got, I never looked back. So that was the point where I pushed myself into regenerative therapy. I made people understand. It's not the doctors. I never went to the doctor saying that, no, this regenerative therapy is going to give a good result. So I went to the public. I made public know about it. I made public look into this. So slowly, now at this juncture, whoever is suffering with the pain, they must be knowing about the regenerative therapy, PRP. So this is how it happened. And now the most best thing what has happened, the beautiful thing what has happened is a lot of orthopedicians started practicing because they believed it. Because the patients go there asking the orthopedic surgeon, sir, can you do PRP? Surgery and all we know. Can you do the PRP? So that's how orthopedicians also started doing it. That's a beautiful change that has happened, particularly in Telugu-speaking states, Karnataka and Tamil Nadu. So North, they still need to get this awareness. So this is how it started, and we are pretty much happy that maybe down the line 10 years, the surgeries, unnecessary surgeries should come down.
So how do you think that, you should reach out to each and every, because we know that degenerative conditions will keep on continuing as we age. So like females, we know, it's a very known thing to females that, after 30, you should start taking care of your skin. After 30, you should start taking care of your hair. You see the hair fall, you are, you go to meet dermatologist and take all the precautions. Similarly, what are the ways that female should know that after 30 my joint is also going to degenerate, my bones are going to weaken. So what are the things that they should be careful about, what are the things they should be noticing, so that they don't land up to a stage where they have to go for such kind of invasive things?
So here I'll be a bit harsh towards the females. I'll tell you the bad, worrisome thinking of all the females in India is, they have to give more importance at home. Household works. That's completely wrong. So females are equal to male. The females, to my knowledge, to my opinion, females should work outside more than at home. Because, so this is the reason, the way the females think, even now the modern females, even the kids, they think that, they have to be more attentive at home than outside, because that has been pushed into the brains of all the females. That is absolutely wrong. Now I've seen doctors. Doctor's job is such a noble profession. If you miss 1 hour, 10 or 15 patients who seek help from you, they'll be having the same suffering. So I've seen doctors, taking sabbatical for their kids. Of course, if the kids are 1 or 2 years or up to 3 years, you can take it. But even for the older kids, like 5 years, 7 years, my son is appearing for the exams of 3rd standard or 4th standard. I want to take leave for 6 months. Absolutely, it's not at all acceptable. Because I'll tell you one thing. The more you think about doing more work at home, the more your joints, the more your body is going to get degenerated early. So what I suggest is, if you attain an age of 30 to 35, start thinking about your body. And people, the females, they think that doing more work at home is healthier.
Yes.
Absolutely wrong. More work anywhere, outside or inside, is going to harm your body. Because it's just like a machine, a cycle. A cycle, if you drive it for 50 kilometers a day, within 2 years, it will go back to completely damaged. And if you run it, 1 or 2 kilometers per day, it will stay longer, like 10 years or 15 years. So basically, if you take care of your joints, muscles, ligaments, spine, right from the age of 30, 35, and giving proper rest while doing any work, will make your body fit and fitter in the old ages. So always females should think about their body and should not think that household work is what for which I have born. That's absolutely wrong. So if males are equal to female, they need to work more. So you have to tell your children, you have to tell to your girl kid, your daughter, work more at home, work more at outside, not at home. So that's what this is basically reverse right now. So what they say, you have to take care of the home, you have to take care of your husband, you have to take care of your in-laws, you have to take care of their relatives, you have to make the house neat and clean. You have to protect your body first. First thing is women health. Then afterwards only husband, kids and all.
Family health.
So you need to protect your health right from 30 years of age.
So now, just like you were talking about, female should go out and work more. Is that the reason that most of your centers are run by female doctors? Like, is that the reason that, you promote female doctors more? Because there is also a thing that, females can do the work better, but maybe they don't have that entrepreneurship or something. Because, when you run your own business and run your own clinic, you need that instinct also. So is that the reason that you feel that females are better at the job, or females do better? That is why a lot of females work with you?
No, sir. See, females basically pain medicine basically is done by anesthesiologist. Anesthesia, large chunk of anesthetists are females only, female doctors. So here also one thing is there. So a lot of females they come to pain medicine because there are no night duties.
Yeah.
A lot of females come to pain medicine because there are no emergencies.
Yes.
That is good only. But don't ever think in a way that no, emergencies are not there. I can do household work more.
Yeah.
That's wrong. Emergencies are there, night duties are there, I can be at home. No. Doctors have to work throughout 24/7. So basically, females are more in pain medicine because they are anesthesiologists. And second thing is, as you told, no, they are good entrepreneurs also. Entrepreneurs in the way, there are positives and negatives for the females in doing any business, medical business or no, as a developing pain medicine as different centers. So the positive things are no, intellectually they're good, they're better than males, so they have patience. They don't have that short temperedness and all. They talk to the patients well, they take care of the patients well, not in a jerky way. And patients feel better when they get treated by female doctors because they're pleasant and their behavior is good. But one negative factor is there, where females have to be very strict whenever you run a center, run a hospital. So that strictness females should learn. Manpower management, so the staff management. So basically, it's hospital where the human life is being
Dealt with,
treated.
yeah.
So you need to have strictness towards the people, staff who are working. So it's one negative point. Or otherwise, females can do a wonderful job in any hospital management. But only thing is, the timings and all, female should be. You should not restrict your timings in medicine so that you can go back home
Yes.
and again do the work. So again, that's going to, harm your health. So these are the things, positives and negatives of the females in a basic.
But how do you also see creating a good work environment and workspace for females in your clinic, or like a male entrepreneur, owner? How do you keep a system where the females working with you, the staff, the doctors, also the non-clinical staff at each level feel safe and they feel protected and they see a good journey in the growth? Like, because I've always seen you telling patients, if I upgrade my car, I want you to upgrade your car. If I upgrade my living standards, I want you to upgrade your living standards. So how do you see that someone who is associated, especially females, because they take sabbatical, then they have some other work because of which they have to leave the job. So how do you keep them with you for a long run? Because it's very important that all this when we grow, the staff should also come with us for a long journey. So how do you create a workspace?
So Epion, basically, 90% of the Epion centers are managed by females only, female doctors.
Yeah.
I give them full ownership. I don't involve all the female doctors who are owning my centers. They take care of the males. The comfort is given to the males there because they are the owners. They are the bosses over there. Because as I told you, they're the best entrepreneurs. They have the patience. They have that what do you call creating a comfort in the staff and also for the patients. So basically, females are the bosses of Epion. Always, So why I made this type of structure is if a female is made a boss or made a owner, rest of the female staff are also, they'll be properly in line. So because the way they deal is not dealt by men properly. So and the way I train my doctors is completely different from others.
Okay.
So what you were mentioning about the win-win situation. So whatever I have, I want my female doctors to have. So always I see that comfort is created to them, and financially, and also the way they take decisions on their own. I have centers in Bangalore, I have centers in Chennai. I never involve in their daily activities, but only thing is I'll call them morning and evening what's happening and all. If they want to do any change, immediately I'll say, yes, you're the local doctor over there. You know the local issues. You can start whatever you want to do. Because basically it's a new department. It's a new speciality. Where in South India we got more number of centers than anyone else. So I need that local doctor to have the perception of what's happening locally in that city. So I give 100% free hand to the doctors. Particularly, I might not have given to a male who if he was a owner, but the females, yes, they listen to us. They listen to me. They listen to their boss, and also once they get trained from me, and I give a free hand. We are in the same line. There is no any conflict. So that's why I give a very almost like 100% importance to them. For the center, I'll tell to them, no, I'm building a beautiful hospital for you. Go and work there. It's your hospital. Go and work. Whatever the way you want to work, you work. But whatever I made you learn, just follow that. That's it. And small changes, whatever you want to do, you can do that.
Now we were talking about women entrepreneurship. तो हमने ये देखा है कि in my practice what we have seen कि अब लोग ऑफिस जाते हैं, अपार्टमेंट्स में रहते हैं, तो अपार्टमेंट से कार में बैठ के ऑफिस को गए, ऑफिस के अपार्टमेंट से कार लेके बेसमेंट में आ गए. सो नाउ दे आर डीलिंग विद लॉट ऑफ बैक पेन, एंड एवरी टाइम पेशेंट्स कम वी सी दैट द प्रिस्क्रिप्शन 100% will have vitamin D supplements written without testing the patient. Calcium written without testing the patient. Is it required or not? So how do you see this? How do you read the prescriptions for people जिसको back pain है, diagnosed नहीं हुआ, but they have been put on vitamin D and calcium? Like, it is really difficult for us to solve this mystery, because patients को भी बोले तो they say नहीं मुझे है vitamin D, my vitamin D is less. Where is the test? They don't have the test. So how do you deal with it? And what's the fact behind it?
The most richest people in India are pharmaceutical companies. Why? Because they create a kind of a need in the public that these type of vitamins are needed for you. This vitamin, if it is not there, you get all the body aches. And for your body pain, whether it's a joint pain or spine, vitamin D is the only reason,
Solution.
the most commonest reason. So scientifically speaking, we all know that the food what we take has got lots of vitamin D. If you are eating a normal food, if you don't have any abdominal diseases where you cannot take a
Absorbed.
proper food, you got plenty of vitamin D in the food, and calcium also. So why this type of craving or branding someone's body pain, the reason is a vitamin D or calcium, is to run the business of these vitamins. People think that it's a vitamin. No, vitamin is basically a vitamin, natural thing. No, if you take vitamin D unnecessarily, and if your vitamin D levels are unnecessarily high, you're prone for lots of other
Toxicities.
illness. So what you need to understand is vitamin D, if you in your blood, if the levels are in normal range, no need to take any vitamin D. It's completely nonsense. But no, it has been thrown on the people. It's been made the people believe that every female, all the women they have vitamin D deficiency. Absolutely wrong. Don't fall into this nonsense thing. Only thing is, if you feel like your body pain is because of the vitamin D deficiency, get a test done.
Tested, yeah.
Test done. If it's in normal, don't take.
Yeah.
Because you need to understand that vitamin D also can cause problems if it is taken in a larger amounts than what you need for the body. So vitamin D is, if not scientifically proven in your blood, is a big scam.
Yes.
Don't do that.
And missing out on the cause of the pain also, because you went to the doctor for pain, they gave you vitamin D, they did not identify what is the reason.
One more thing, people should understand. A lot of patients, they come with a knee joint pain saying that, sir, my vitamin D levels are very less.
Yeah.
Vitamin D deficiency can cause pain, but not a regional pain.
Yes.
It's basically, a vague pain all over the body.
Yes.
If you're having a shoulder pain alone, or if you're having a spine pain alone, don't, make the vitamin D as a causative factor.
Yes.
It can never happen. It's a vague pain. If the vitamin D levels are very less, vague pain where no every structure you do an MRI or X-ray, it will be normal. Then it can be vitamin D deficiency, not the regional pains.
Yes.
If you have a pain in one joint or one in spine or anywhere, in the peripheries, no, vitamin D is not the reason. So people should understand that.
Yes. And same holds true for glucosamine also. Lots of patients will be taking glucosamine continuously for years, and they get some US manufactured glucosamine and they says it work wonders for me. So what is your opinion on that?
Again, pharmaceutical industries are very rich because of all these vitamin kind of illusions they have given to the public. So glucosamine, chondroitin sulfate, curcumin, all these things, no, they will never increase the cartilage. There are no any proper clinical studies saying that no, all these things which are supposed to be, I mean, in the advertisement they say that they are going to increase the cartilage. It's completely wrong. Don't ever believe in the fact that no, if some doctor is writing that no, glucosamine or the chondroitin sulfate is going to increase your cartilage thickness or it is going to remodel your cartilage, is absolutely wrong thing. Don't ever think or believe in those terms.
Yeah. And when we move ahead and we talk about injections, what we do, the regenerative and all those things, we it is initially very difficult to convince the patient that one injection of mine is going to take care of the damage, and the damage is huge. When we talk about a degenerative condition, if it's a frozen shoulder, there is a muscle tear, or if it's a knee joint arthritis, there is a huge changes. So how difficult it is to convince the patient that my injection is going to help you out and get you cured of the condition, improve your quality of life.
So this regenerative therapy, as I told you earlier, 8 years back, we have basically got this into the public. So now we are fighting, or we are creating an awareness to the public, and basically the conflict is between 50 years of one treatment and 8 years of another in a small injection.
Yes.
It's very difficult to convince the patient, saying that no, I can basically make you completely pain free with a small injection. But the fact is, surgery, a degenerative condition, whether it is a knee joint, whether it is hip joint, whether it is a shoulder joint, whether it is on the spine, basically the problem or the pathology inside that particular joint is very small. It's not that knee joint osteoarthritis means it's not like the whole of the knee joint will be completely damaged. It's not like that. Because as an anesthetist, whenever my friend's orthopedic surgeon opens the knee joint for a knee replacement surgery, I go and peep into that surgery. Basically, anesthetist, after giving anesthesia, we go and see the surgery, what they are doing. After opening the knee joint, the damage will be not even 1 inch or 1.5 inch. The surgeon, where is the problem? Why are you operating? So after opening the knee joint, everything is perfectly all right. Only the cartilage, in a measurement of 1 to 1.5 mm thickness, and also the 1 inch or 2 inches of the length of the cartilage is wrong. So instead of treating that, why we should remove the whole knee joint? So people should think that wherever is the problem, why can't we correct it?
Yeah.
Why can't we remodel it? Are there any systems or are there any treatments like that prevailing since all these years? Yes, it's there. That's the regenerative therapy. So making it believe that this is only the small area which is causing pain is a bit difficult. So that's what we are doing now. Yeah. We are making the people learn that this is what the problem in your structure, knee joint, shoulder joint, or even spine also. Now what we are doing is we are correcting this damage by your own blood. So making the people believe that your knee joint or your shoulder joint or spine, what is the problem? And the problem is a mere 1 to 1.5 inch or 2 inches damage. And we tell them that there are lots of treatments where with your own blood only. Blood has got a plasma has got platelets have got growth factors. The name itself, the cell's name itself says that growth factors. These growth factors, if we inject exactly at the place where the damage is there, it is again going to remodel or regenerate. This has been there since 30, 40
Many
years. No one were dare enough to, uh, take this out and, introduce it to the public. We have done that.
Yeah.
And now people started believing it all these 8
Yes.
years. We've been facing lots of hurdles because of the medical personnel, because of the other people, pharmaceutical people, the industry people also.
Yeah.
But one thing is we were adamant.
Yeah.
We were stubborn. We are going to, make people learn about this,
Yes.
believe in this. So now people are asking and going to the hospitals and asking that, no, I need PRP.
PRP.
I know that what's happening into my
Yes.
knee joint. So I need my joint to become normal without surgery.
Yeah.
So this is a power of regenerative
Yeah.
therapy.
And the results are seen. In the last 8 years, the results what have been seen. That is why there is people asking about it. And the best part is we should never go against nature, right? So it's a very natural way that you have introduced.
Natural damage to the body has to be treated naturally.
Naturally, yeah.
That's it. No need of putting an artificial things
Yes.
into it, and no need of cutting and again suturing and all.
Yeah.
So, to the maximum extent, if you all of the doctors, including orthopedicians, spine surgeons, everyone, start doing this, there will be a beautiful change in the
Yes.
world. So people should not suffer because all the surgeries have got some amount of complication. Why we need to subject a person to the complication when it's not a disease itself? Knee osteoarthritis is not per se is a big syndrome. Shoulder supraspinatus tear or rotatory cuff injury is not a disease. ACL injury is not a disease. Why can't we deal with it with a minimally invasive fashion?
Yes.
Naturally, not injecting any chemical into the body.
Yes.
If it is happening,
Yeah.
so in Ipion it's happening.
Yeah.
Since 8 years we've been doing this.
Yeah. And that we have seen with spine surgeries. Patients go for spine surgery for disc. They remove the disc or they put a plate and screws and everything. Maybe that part is cleared, but the patient definitely will come back with some other kind of pain. It's a facet joint pain or SI joint pain.
Yeah, see what happens, for any condition in the body, if it is the body is open, the skin is cut, you go inside, splitting this, tissues, breaking the bones and all. No, initially the symptom what the patient is having might have gone, but the changes of the surgery, changes of the nature of the surgery by cutting and all, forming fibrosis, and different things will happen inside, changes will happen inside, that can create a complication after 2 or 3 years.
3 years, yeah.
So keep the body intact.
Yes.
Don't cut it.
Yeah.
So this is the future. The advancement of healthcare means don't disturb the body. Treat the body as it is. Don't go inside and disrupt the structures, remove it, put a new one. This is not the advancement. Advancement is something else.
Yes.
So previously you used to see 1 MB of hard disk used to be like this room size. Now 1 MB means it's a small tiny thing of
Yes.
1 mm. So that is advancement, not this one.
Yeah.
So that's why you need to understand that. People need to understand that. Regenerative therapy for all the chronic pains, particularly joints and spine, is going to be the future and present also.
Yeah. And when we talk about injections, we also find, people have a lot of myths about injection, and very commonly, that, while delivery, they gave me spinal anesthesia or they gave me epidural anesthesia, and that pain has remained with me for lifelong, and they come after 2-3 years saying that I have back pain exactly at the place where the injection was given. So this has also been, embedded in patient's mind. How to deal with that?
So particularly in females, women after the pregnancy, for the delivery they go for C-section. They get a spinal anesthesia injection. Afterwards, maybe 6 months or 2 years or 10 years, even after 10 years also they get pain. And they attribute this to the injection what they have taken from the anesthesiologist. That's wrong. Basically, it's not because of the injection. So injection is a small injection, 24 gauge. 25 gauge injection. Basically what happens, after the pregnancy, basically pregnancy and cesarean section. So the baby will be in the womb. So as the baby grows, there are lots of structures, no, they get stretched,
Stretched.
particularly the pelvic bones, particularly the joints of the pelvis. To the maximum extent, no, the joint which is known as the SI joint, sacroiliac joint,
Yeah.
it gets stretched. It has to get stretched
Yes.
to accommodate the baby of 2 or 3 kgs baby. So once the delivery is over, again the structures have to come back.
To normal.
Though to those ligaments, no, which have been stretched, no,
Stretched.
during the pregnancy, they have to normally come back to the normal areas. If there is any malalignment of these structures coming back to normal, then it can cause pain. At least 7 to 80% of the post-pregnancy females complaining of back pain is because of the sacroiliac
SI
joint
joint.
dysfunction. So this is basically because of the phenomena of the pregnancy, phenomena of the abdomen becoming large, and after delivering, no, again, if they don't come back to the normal shape, then it's going to cause a lot of back pain, and there are lots of treatments in regenerative therapy to counter this one.
Yes.
So you need to understand. So I want to tell one thing, no, spine is a big mysterious thing. Spine has got lots of structure, lots of nerves, lots of ligaments, lots of bones, lots of discs, muscles. So in a back pain particularly, if you don't identify the pain generator, the structure which is causing pain, no, it can go in a wrong way. If you treat it in a wrong way, without identifying the structure which is causing pain, that is going to be a catastrophic situation for anyone, man or women. So basically, if it's other joints, it can happen so, but if in spine, no, it is going to be very, very dangerous. So
Yeah.
you need to, because there are hundreds of structures.
Pain generators.
So you need to identify that structure. Now people go wrong in identifying, just like in pregnancy, where this SI joint, if it is underdiagnosed, and you start operating on the disc, or you start operating on the, something else on the joints and all, no, it is going to be a hell for the
Yes.
female in the rest of the life. So you need to identify and also be very careful.
So coming from here also, sir, like, we know that most of the time it is SI joint pain, the joint pain. And when they tell it to the family, when the ladies tell it to family, they are told, no, it's the injection pain you've taken. And then they say it's all in your mind, and then, it's all psychological pain, and people around are not ready to believe. And then it is so difficult when the patients eventually come after 5 years, 6 years, 7 years. Their quality of life have been hampered, their social life have been hampered, the relationship with spouse have been hampered, and eventually when they land up to us, they tell, when we try to tell them, no, we examined you, we found out the reason is SI joint pain, they're not ready to accept it, and they self-diagnose, or maybe someone has told them it's fibromyalgia. How difficult it is, sir, at that point of time.
So that's why I tell you, the only answer for this, don't listen to anyone. If it's a case of your own health, own female's health, why you want to listen to your husband? Don't listen to them. You don't listen to your mother-in-law. You go to a doctor. Women empowerment is this only.
Yeah.
You need to take care of your health. Don't depend on anyone else.
Yes.
You have back pain. You have doctors, so many doctors.
Yeah.
Go to the doctor. Why you want to make yourself inferior?
Yes.
Go to the doctor and get the diagnosis done.
Evaluated.
Your mother-in-law is not your doctor. Your father-in-law is not your doctor. Neither your husband. So that's what I tell you. You have the liberty. You have the power to, do anything if it comes to your health. Because if you are not healthy, no one will respect you. Every day you complaining of pain, they'll curse you. They'll say that you're doing a drama to avoid the work. Don't do that. Get your body checked up. Go to a good doctor, go to a female doctor, or go to a spine surgeon, go to a pain specialist. Get the proper diagnosis done and treat it.
Yeah.
Don't listen to them. This is what the main point in India is, Indian females, whether they are working, whether they are not working, whether they are entrepreneurs, whether they are IAS officers, whether they are big politicians, they are succumbed to the family, situations, family restrictions. That is absolutely nonsense. If you are a self-dependent individual, just like a male, don't be under the influence of anyone else. It's your health. Go and treat. Go take advice. That's it. You see, people outside, no, they talk a lot. I tell to everyone, no, females, they say, no, no, I have lots of work at home, sir. This relative will come, that relative. Don't allow the relatives in your home. Why a relative should come? Even if they come, no, they should stay for half an hour and go off. Even if they come, no, ask them to work.
Yeah.
Ask them to help in the work. So I seen a lot of patients, no, saying this, no, house is a big family, common family, or what do you call it?
Joint family.
Joint family. Joint family means it doesn't mean that no, you have to work. Everyone should work.
Yes.
Joint family is a good thing. Where everyone works, no, everyone will get a proper rest. Everyone will get a proper health. So this is more important than going for treatments of vitamin D, injections, surgeries. You need not go to a doctor. If you take care of your health from 30 or 35 years, if you have some problem, go to your family doctor. Get evaluated. And what are the precautions they say? Listen to them. See, in my clinic, I see around 50 to 60 OP. Only 5 or 6 members, they get treatment on the day. Why? Because they want to discuss that
family.
treatment with the family. Why you need to discuss? Only financial issue you need to discuss. Who is the husband to take a decision on your health?
Yes.
No. Father-in-law, no. They have to give money, that's it. For that only you take time. So 90% of the people, they want to go back again, discuss with the in-laws, discuss with the mother and father, discuss with the brother who is in US. There's no point.
No,
See,
yeah.
you believed in that doctor. Doctor has explained you properly, and he said that this is the treatment. You insist on the treatment to the family members.
Yes.
Don't ask their opinion.
Yes.
It is the female's opinion who is suffering.
Yeah.
That is more important. So if the society changes in this way, then everyone need not go to the hospitals. All these corporate hospitals, no,
Come down.
the footfall in the corporate hospital will come down. You damage your body intentionally, knowingly, and you run to the hospitals,
Hospital.
paying lakhs of rupees to the corporate hospitals. That is wrong.
Yes.
So from 35 years onwards, take care of your health. In your rest of the life, you will never see a doctor. That's what I tell to every patient. You have come to me, okay, for this condition I'll treat you. But today, I'm treating your knee joint. Tomorrow, if you start, believing in this treatment, if you start following my orders, no, you'll never go to hospital for any other joint. This is what I say. I promise them also. But they have to
Listen.
follow whatever I tell.
And we see a lot of sports injuries. We see a lot of gym injuries coming to us, where they go out, they lift. Recently, we saw how Rakul Preet also suffered with some kind of injuries. And they are like, no, we are into it since long and this injury cannot happen to us. It could be because of overuse or wrong way of doing things. So what's your opinion on exercises, gymming and other physical activities? A lot of patients with knee pain, they go for trekking. So, how do you take it and what's your thing that you want to say?
See, basically, these terms like exercise, marathons, gym, acrobats, Zumba dance, all these things, are there in particularly with females. No, so this is a result of unnecessary hyperinformation from Western countries. See, in Western countries, they do cycling,
Yeah.
they do trekking,
Yeah.
they do gym, they do marathons and all. These they are doing since their childhood.
Yeah.
In India, what's happening is we are copying that.
Copying.
That at the age of 30, 35. You're not a cyclist
Yeah.
since your childhood.
Yeah.
You never trek during your childhood or whenever you're going to the college. You never did a marathon also during your childhood or in your schools. So what happens, suddenly you start something, copying from the neighbors and copying from a, celebrity, copying from a film star, and you think that you're going to become like that, doing all these things, will really ruin your body. So all these 5 things, which I told you, if you want to do, where there is absolutely no scientific evidence that gym, cycling, marathon, walking and running, is going to give a good health for you. Absolutely, there is no scientific evidence. You do it because others are doing. You copy it because no, tomorrow you'll have a beautiful body like Rakul Singh and all. That's absolutely nonsense. It will never happen. But if you want to do exercise, yeah, exercise is good, but go to a doctor. Go to the MBBS doctor. Tell them about your age, your body condition, you have any pains and all, and how much exercise you have to do per day. That's it. That is the exercise. I'll tell you one thing. Exercise, fitness doesn't have any relationship to health. Exercise, doing a everyday exercise, doing a good walking of 5 kilometers every day, or going to the gym, or going to doing cycling every day, don't ever think that no, that is going to protect your health or that is going to make your health better. There are no any medical clinical evidence saying this. But what the doctors or medical science says that American Heart Association, what it says, no, it's about the heart. Every week, 6 days, half an hour to 45 minutes, mild to moderate physical exercise according to your age, according to your body condition. If you have, for example, knee joint pain, don't do exercise onto the knee joint pain, knee joint, and do other exercises. If you have shoulder pain, don't do shoulder exercise, but half an hour to 45 minutes, mild to moderate, not a strenuous exercise. You go to KBR Park, every day you see around 600 to 700 members walking all around the KBR Park. One round is a 4 kilometers. They think that no, after walking for 4 kilometers, they're going to become, like they've just climbed an Everest. But what they don't know is the damage what is happening to them inside. The knee joint from today onwards. If you start today walking, the knee joint which is going to stand for 10 years is going to get degenerated within 2 or 3 years. Yes. They don't know that. So what they have got by walking 4 kilometers? Nothing. You just do half an hour to 40 minutes of walking. That's more than enough. And females also, be careful. Don't go to the gyms unless you are told by your doctor. Don't listen to a gym trainer. Don't listen to your neighbor. Don't listen to your film star. Don't listen to a sports person. What you are, what is your job, what is your body habitus, what is your age, according to that only you do exercise. And thinking that gym is very good for health, dances are very good for health, fitness is directly proportional to health is absolutely a myth. So health is completely different. Health means you are having a good health means you are not having any disease. That's it. Yeah. If someone is looking like good bodybuilder like Hrithik Roshan, and you think that he will not have any disease in future or in the present, is absolutely wrong. So health is different from fitness and all these things. Be careful with the gym, cycling, marathons and all. Don't do them unless if you want to do them, take an advice of your family doctor.
And that is the fact, sir, that when it comes to treatment with a doctor, if you, like you're saying, if they want to get a PRP done with us or not, they will be thinking. But if they have to go to a parlor, they will never take anyone's opinion. It is their decision. I'm not looking good, I want to go to the parlor. So they make their choice of going. But when it comes to health, they take multiple opinion, and where they get stuck. So women empowerment is not only about achieving something in life, it's about taking care of your good health. So as we end on this note, sir, what message you want to give to females of our country? You have been talking a lot about how to take care of health, but one thing before we end.
See, I'll tell you only one thing, Dr. Minal. Female are the beautiful thing that God has created. So, but in India particular, I don't know about the Western countries, females are being not properly treated by themselves. Yeah. So they themselves, they don't have a care on their body. They should have care on their body. They should take care of the health. They should take care of health first, then household works, then the husband, then the kids. So if you take care of your health properly, if you take care of health in a way that you have to have a proper rest, proper work and proper mental peace, then the females are going to rock the world in the future. So don't get into unnecessary troubles by overusing your body. This is what I want to say. So when you are healthy, everything, the whole world will be healthy.
Thank you so much, sir. Thank you so much for coming. And, for my first podcast, I always wanted to start with you because no other person, because you have mentored me, you have got me into this place, and no other person would have done justice to my podcast. Thank you so much. And I hope that those who are listening will now be aware about their own health. Thank you so much.
You're welcome.